I have with me today Professor Rabea Asleh, Director of the Heart Failure Unit and the Cardiovascular Research Center at Hadassah Ein Kerem, and one of the members of the team that performed Israel's first artificial heart transplantation. And I'm Maayan Hoffman, Executive Editor of ILTV, and I welcome you back to the ILTV News Podcast. And welcome to you.
Hi, Maayan.
I want to start out by having you just tell me about this procedure that took place at Hadassah. I know also a second one at Sheba Medical Center. I understand they happened both in the same week, the first ever artificial heart transplants in Israel. Did you know this was going to happen? How was it coordinated? Just give me briefly what went on.
Yes, so we performed at Hadassah the first implantation of total artificial heart developed by Carmit company. It's called ISIN. It's total artificial heart that is implanted as a replacement of the native heart. So we did it in the beginning at Hadassah in the last week of May, and then 4 days later it was done the second case at Sheba Medical Center. Actually, it was not a formal coordination between the two centers, but both teams were well prepared and trained for several weeks before the surgery. And it turned out that the two patients were found eligible for the device implantation. So we got support from the French team who came to give us support for the initial implantation of the device. And then another patient was found to be eligible for the procedure during the same week at Sheba. So it turned out to be a good opportunity for the team to stay in Israel and perform and help with the performance of the second case. So it's a kind of fortunate conjunction of readiness, training, and patient need.
Unbelievable. Now, if I don't mind, I'm just going to ask you to turn off the beeping on your phone just because it will impact our listeners' ability to be able to hear the podcast. Now, tell me something. What is an artificial heart exactly? You know, what kind of heart is it? What's it made of? How does it work?
So total artificial heart is a biocompatible device that includes mechanical materials. It includes two ventricles, the right and left ventricles, 4 biological valves, and different components, including biological materials that are in the internal layer that come in contact with the blood and prevent or decrease the risk of blood clotting. So it's a total artificial heart that pumps blood in replacement of the native heart and works with electrical power.
Professor Asleh, what does it look like?
It's like a size of 2 fists, shaped together to resemble the natural heart. It is a combination of valves and 2 ventricles that is connected to the arteries and pump blood effectively to supply the body organs. And there is another sensors that can sense the blood flow and adjust the pumping function based on the patient's need. It also has a cable that comes out through the skin at the Bill's button level on the right side, and it's connected to electrical sources, batteries, and controller that adjust and make the appropriate function of the device.
So this might sound like a bit of a silly question or a stupid question, though I was raised there are no stupid questions, but how does a patient who has this electrical device inside him but also coming out of him with this cord you're describing through the skin shower, go swimming? Can he or she do any of that?
Yeah, it's a great question. It's not silly at all. I think patients can't swim and they can't be submerged in water because of the cable that is connected to electrical power. So they can't swim, but they can have a shower using waterproof solutions, and after covering the area where the cable exits the body, so they can have a shower using specific solutions, and with the education of the medical team and with the assistance of one of the family member.
Fascinating. And I guess in some ways, like, it's like having a cast, right? Like when you have a cast, you have to cover it to get in the shower, but you couldn't really go swimming or things. I guess it sounds a little bit like that. Another, kind of a stretch of a question, but it's an artificial heart, and the heart is part of what regulates our emotions and the way we feel. So when you put a device like this inside in lieu of the real heart, does it change any of that? Does it change the way that your emotions are?
So feelings and emotions are not controlled by the heart. They are generated and regulated by the brain. So, I think while the phrase heartfelt is poetic, still the heart can't control or make the differences in feelings and emotions. So it's totally regulated by the brain.
So has this been done in other patients outside of Israel? Where else are these hearts positioned?
Yes. So this device has been implanted several times in Europe, and there also have been a few cases in the United States. So the CarMed company got approval from the European Union in 2021, and since then about 114 cases have been implanted, but we did the first case in Hadassah and then the second case at Sheba Medical Center.
Sure. Now, tell me in terms of who your patient was, not obviously his name, there's obviously, information we can't share, but can you tell me kind of what age he was, what he was like, what kind of condition he had, so that he was eligible to receive this device? Sure.
Without getting into personal details, what I can tell about the patient that he is a male, on the early 60s of his age, and he suffered from severe heart failure of both ventricles, the right and heart ventricle, and he was hospitalized several times over the last few months with exacerbating heart failure or worsening heart failure, requiring medical therapy and all other things to support his heart. And he reached a point that there is no option to manage his heart failure except for the heart transplantation or introducing the total artificial heart as a good option for him. So he was not eligible for heart transplant at that point because of medical and other behavioral conditions like active smoking or tobacco use. So he was not eligible for heart transplantation, and we don't think even that he will stay alive waiting heart transplantation. So this was a good solution to save his life.
And I mean, if he has behavioral issues that would alleviate or prevent him, I should say, from having a heart transplant, why would we give? I mean, this is a very expensive device from what I understand. So why would we put the artificial heart in him?
So the total artificial heart is a bridge to transplant option when the patient is not eligible for heart transplant or there is no hearts available to get him transplanted. So in such cases, we need a solution to save the patient's life. So we go for mechanical circulatory support devices, and in his case, no other devices were suitable for his case because of biventricular failure. And we found that the only option is to bridge him with this mechanical circulatory support device, total artificial heart, until he gets heart transplant in the future.
Who else was on your team? I know you're not the surgeon, so there was more than you.
Sure.
Who were the people that were around you, and what kind of staff did you need to get this done?
Yeah, so this is a teamwork. We actually did a nice coordination of several specialists at Hadassah, including cardiologists, mainly heart failure experts, cardiac surgeons, anesthesiologists, intensivists, nurses, and all the staff that worked all together to make this happen and succeed. So the team, including me, I was fortunate to be part of the team, traveled to France for training, and we got preparations and training, including hands-on experience with live surgeries done in animal models to get the experience of the technical things and the preparations for operating and managing the device itself.
And how many people were in the room from this team? Like when this actually went in for the first time into an Israeli citizen, how many people witnessed it?
Many people.
It was many. That was was it more than a dozen doctors and nurses, etc.?
Sure. Yeah.
Wow.
It was a special event and actually history in Israel to have this event being done as a first total artificial heart transplant in Hadassah. So it was a unique opportunity, and many people followed that and were impressed by the achievement.
For sure. Hadassah must have been so excited for it to be the first one there. Wow. So how long is this heart going to function? You mentioned that it's a bridging heart, like until you would be ready or eligible, or a heart would be found, I guess, for transplantation. Yeah. So what do we think? Is this like a year, 2 years?
Yeah, so this device is managed or designed to support the patient for several years. On average, 2 to 3 years, but in specific cases, it may last longer. But the approval is for a bridge to transplant. It's not destination therapy. What I mean in destination therapy, that it's going to be the definitive treatment for the patient for the rest of his life. But this is hopefully will happen in the future. But at this point of time, the device is only approved for a bridge to transplant for several months up to a few years until heart transplant is available as a terminal or ultimate solution.
And I assume that one of the reasons this is so helpful is because it's very difficult to get heart transplants. I want to talk a little bit about the numbers here in Israel, just to give our viewers an understanding of, what the heart donation or heart transplantation system works like. So how many hearts are available for transplant in Israel? Like, is the waiting list very long? Do you know how many patients are on it?
Yeah, sadly, the heart donor availability is low. So many patients don't make it until heart transplantation, and they unfortunately die before reaching heart transplantation because donor availability is low. So we're talking about 25 up to 40 in good years of heart transplants in Israel, and the waiting list is much longer than that. We're talking about more than 100 patients in the waiting list. So the need exceeds the supply of heart transplant. So we need the mechanical circulatory support option to save lives and keep the patient alive until getting transplant, while waiting for several months or years.
Of those 100-something that are on the list and the up to 45, let's say, who get transplants, so you're talking about more than 50 patients on the list that don't get a transplant in a given year. How many of them die because of this, not being able to get a heart?
The estimation is around 20% of the patient on the waiting list die and not reach heart transplantation. So so I think the total artificial heart, because many of these patients have biventricular failure, so we can't give them another mechanical devices to support, for example, the left ventricle with the left ventricular assist device, LVAD, is another option of mechanical support. So in many of these patients, when they have biventricular failure, the only option is total artificial heart or waiting on the waiting list until heart transplant. And unfortunately, many of them don't survive until heart transplant, so they need this device.
With this device, do we think we could actually eliminate that 20%?
I hope so, but because these devices are very expensive, so the coverage is limited, and only a few patients are approved annually in Israel to get total artificial heart support. So the need is much higher than what we can cover or support.
How much does it cost, this total artificial heart?
So total artificial heart by Carmit costs approximately $600,000.
Wow.
This includes the device cost, in addition to the surgery, intensive care, and follow-up and technical support.
Uh-huh. So do the health funds cover it at all? Like, I thought that some of these two patients, for example, were covered by Maccabi, one of our health funds, and by Clalit. Is it in the basket, the health basket, or is that a specific case?
Yeah. So the Israeli National Health Basket covers up to 5 cases annually of total artificial hearts. So because of the expenses are really high. But fortunately, in the future, when technology advances, when more companies enter the market and the costs decrease, hopefully we will see more coverage and more cases will be appropriate or in the market, feasible to support these patients. So with the advances in technology and decreasing the cost, not only more devices will be implanted, but hopefully the devices will be implanted for longer support as destination therapy, as mentioned before.
That's very interesting. Now, who decides who gets these artificial hearts? Like, is there specific criteria? And then who makes the call? Is it the health fund, the doctor? How do we decide here in this country if only 5 are going to get it, but there's more than 50 who need it?
Yeah, it's a multidisciplinary approach, and there is a heart team working and consulting on every patient who is a candidate for mechanical support. So we meet all together, cardiologists, including heart failure experts, surgeons, and we discussed case by case. We follow all the medical condition of the patient. We do several imaging modalities, catheterization to assess hemodynamics and the medical condition. And based on the situation, on the medical condition of the patient, social support, behavioral issues, we get the decision whether the patient is appropriate candidate. So patient selection and timing are the key for successful mechanical circulatory support.
You mentioned
treatment.
that it wasn't coordinated with Sheba. So is it like by hospital making those decisions and then you go to the health funds and appeal, or the health ministry, or is it a coordination between the hospitals looking at all their patients and saying, among the existing patients in Israel, these are the best candidates? Because I think about, Hadassah's in Jerusalem, for example, where it's a little bit in some ways more affluent, a larger city. Hadassah is a very large and powerful hospital. There are hospitals maybe more in the periphery where a patient might be equally as in need, but maybe would not have that same team or access. So how does that coordination work?
Yeah, so we accept all the consults from different places, including in the north and periphery. So we sometimes bring patients for consultation and assessment. The discussions first are internal. So we do internal discussions in Hadassah. And then if we need to list the patient for heart transplant, for example, it's a national list. So we need to discuss this with other hospitals, other big hospitals like Sheba or Benson, to get the patient listed for heart transplantation. But for the mechanical support, we do usually internal discussions as a teamwork, and we get the decision whether to proceed or not.
Makes sense. I mean, you mentioned you flew to France to get trained to do this procedure, and then they came in here to help you when you did the procedure. Did I understand that correctly? Who is this French team? How did you find them, and how did that come to be?
Yeah, so we traveled to France for several days, and we get all the technical support from technical people as well as medical team, including surgeons who help us to understand the technique of the procedure and how to operate and manage the device itself. So the team included cardiologists, surgeons, perfusionists, and anesthesiologists, mechanical circulatory support coordinators, all travel to get the experience. So the French team gave us the support and also traveled here to give us also the input and to be on for on-site support during the surgery. So I think they global collaboration that Hadassah managed to do as a team at Hadassah and in assistant and collaboration with the French team makes this happen and succeed.
Did Sheba also train with those same French doctors?
Yes.
So I hate to ask this, but was there any anti-Semitism or any feeling of not wanting to collaborate with Israel because France has really been very vocal on the issues with the war?
We didn't face this. I think all the discussions and all the communication was straightforward. We didn't feel any anti-Semitism or big issues with the communication, and they were happy to come and they were very supportive. So we didn't feel any differences or.
It's really nice to hear. Yeah. So what percentage of the Israeli population is actually suffering from heart disease or heart failure? And can you compare that, let's say, to France or other places in the world?
Yeah, so we have hundreds of thousands of patients suffering from heart disease and around 180,000 individuals who are suffering from heart failure. So we are talking about 2% of the 10 million citizens in Israel suffering from heart failure at the different stages of the disease. Not all of them require mechanical support, but most of them do not require that. But around 5 to 10% of patients with heart failure may develop advanced stages of heart failure requiring advanced therapies like total artificial heart or LVAD.
I'm sorry, just for a moment. How would you define heart disease just for our viewers? I mean, what are these examples of? Is it clogged arteries when you say heart disease? Is it the very preliminary stages? Maybe diabetes leading to heart disease? What would be the range of ideas under heart disease?
Heart disease is very heterogeneous. It's a class of different diseases, and we're talking about a leading cause of death worldwide. In Israel as well.
Oh, I thought cancer was number one in Israel.
A leading cause, but not the leading cause. Not the leading, but a leading. We've talked all the cardiovascular disease, including stroke and peripheral artery disease, and all that. Maybe the leading even cause of death worldwide.
Is that because we've gotten so unhealthy? Like we just eat bad and we don't exercise enough anymore, like the Western countries?
Yeah, there are different causes and risk factors for heart disease. Coronary artery disease, inherited cardiomyopathies, and hypertension, diabetes contribute to development of heart disease, including heart failure. So I think early detection and treatment are very helpful. Managing risk factors, managing hypertension, diabetes, maintaining a healthy lifestyle and physical activity will decrease the risk of heart failure disease, including heart failure.
Do you see us in Israel going in the right direction or in the wrong direction in terms of prevention of heart failure and heart disease?
I think Israel is one of the leading countries in medicine in general and technology and in heart failure management. I think this big step that we did as being one of the leading countries in introducing this advanced technology and supporting patients with advanced heart failure that makes Israel as one of the leading countries in medicine in general. Also in prevention, we can see the decrease in several entities of heart diseases, heart attacks, by introducing different and unique therapies for preventing heart disease, statins, antiplatelet therapies, all the medications to control risk factors, the decrease in cigarette use, tobacco use, smoking, and all the other unfavorable behaviors decrease the risk of heart failure and heart disease in general.
Amazing. Now, if someone is experiencing the beginning stages, let's say, of heart failure or even, later stages, beyond, as you mentioned, the artificial heart and some of the electronic devices that can be used to help, what are other kinds of treatments? What are the more common therapies that we might see?
Sure. So most of the patients don't require mechanical circulatory support as a management of heart failure. Heart failure has different stages, and the treatment is usually not reaching the point when we need the mechanical circulatory support. So usually there are several pharmacological agents that can be used in heart failure, and there is a big advance or progress in the treatment of heart failure over the last few years. all the medical therapies can improve heart function and symptoms. We are talking also about several devices, pacemakers, defibrillators that can also help managing heart failure. Few patients who don't respond well and continue to progress to more advanced stages may require advanced heart therapies. So regarding advanced heart failure therapies, they may include mechanical circulatory support. Not all of them are total artificial heart. So total artificial heart and heart transplantation are maintained mainly for very advanced cases of biventricular failure, but we can use left ventricle assist devices. This is a durable device that assists the heart, so it's a pump that is implanted in a surgery and help the heart to pump blood effectively, but not by replacing it as we do with the heart transplantation or total artificial heart implantation.
Because I assume also the heart transplantation comes with a lot of risk. Like I know that when a real heart is transplanted, then there's a risk of the body rejecting it because it's a new organ, a foreign object, and the body will fight it. Is that also the concern with the artificial heart?
Fortunately not.
Wow.
We don't use anti-rejection therapies with mechanical circulatory support devices, including the total artificial heart, because these are mainly mechanical, devices, including biocompatible materials, but not the whole organ like in heart transplantation. So there is no risk of rejection, and we don't use immunosuppressive medications. So this is a big advantage of a total artificial heart in this case, that there is no risk of rejection. But we need to deal also with other issues like the mechanical durability of the device, infection, and technical issues. Because the cable exits the body at the belly button level, so there is a risk of infection. So infection is the Achilles heel of these mechanical circulatory support devices in general. So we need to deal with the infection and try to maintain this to decrease the risk with appropriate dressing and changing and education to the family as well.
Do you have a hole in your belly button when this cord comes out? Is that what it is? Like you literally see it coming out of your stomach?
There is a cable that comes out. It's not a big hole, but it's as big as the size of the cable itself. So it's a few centimeters, but there is a dressing that is put at the exit site to avoid infection and water entering.
Wow, crazy. So Professor Asleh, we're going to run out of time, but is there anything else that you want to share or you want to add that you think people should understand about this procedure?
Yeah, so I think besides the advances in technology, there is a big step forward in giving hope for patients with serious medical conditions that were considered previously untreated. And I think the second thing is the multidisciplinary teamwork that it's amazing, including at Hadassah, working all together, collaborating with leaders internationally. So the global coordination and collaboration is fascinating. I think this helped us to bring Israel to the leading point in medical devices in supporting heart failure. And I'm happy that Hadassah is leading the way further.
Unbelievable. Well, Professor Rabea Asleh, the head of the Heart Failure Unit at Hadassah Ein Kerem, thank you so much for being here today.
Thank you for having me. Thanks.